Hello, welcome again to the African Emergency Room. Thank you for joining us today. Like you know here, we just try to discuss what we see in the emergency rooms, especially some bizarre looking things, and then we try to address it in the way we can. And then in the course of our discussion, you may just get what works for you. So we've been considering how we've been able to handle our issues even before orthodox medicine came to us. You know, our people have been able to sort out themselves in one way or the other, and we know it's even difficult for so many people to move from the unorthodox to the orthodox and to marry the combination of both of them. So today we'll be looking at some of the effects of the wear and tear of life. We're talking about low back pain today. In our clinics, every day, and even in the emergency room, we see people come with low back pain. Those who have lived with it for a while, those who it gets increasingly more difficult to get around, and those whom are even brought into the emergency room because they are not able to stand and walk. We're going to be addressing them today. Today we have a special guest in our studio, a very senior colleague and teacher. We are glad to have him here today. He is a senior registrar with the Department of Orthopedic Surgery at Obafemi Awolowo University Teaching Hospital. He is Dr. Efosa Obawonyi.
Thank you very much, Dr. Alex, for having me on this program today. It's my pleasure.
You don't know how happy we are to have you. I heard that you were in town, so I said I won't miss this one. I had to drag you to the African ER to come and talk to us about low back pain. Thank you so much, and welcome to the African ER.
Hello, Sato.
Yeah, so the low back pain, I'm sure you see a lot of it. What is this low back pain?
Thank you very much, Dr. Alex. Low back pain is a common symptom in the general populace. However, for the sake of my viewers out there, I would want to define the key words, low back and pain. Now, the low back is that part of the back of a patient, of an individual that is occupied by the lumbar vertebrae, that is those at the lower part of the back. Then pain. Pain is an unpleasant sensory and emotional illness which is associated with actual or potential tissue damage, or described as such damage of such. And I want us to know that low back pain has been existing for as long as one can remember. Even at certain times, they were saying that it was a curse from the demons, that people who are affected by such would think people are doing it, maybe it was caused by an individual or someone they just already.
It was sent.
Now, about 80% of the general populace have had or would have had low back pain at one point in time or the other.
Yeah.
And we also discovered that about 14% of patients coming to the orthopedic clinic complain of low back pain. And that is the reason why it is the third leading presenting symptom in the orthopedic clinic.
Wow. Okay, thank you very much, Dr. Efosa. It's that serious.
Yes.
Third leading cause of patients coming to the orthopedics clinic. That means many people are moving around with this pain and maybe suffering and smiling.
Yes.
What are the causes of low back pain?
The causes of low back pain is quite much, but however, I want to start with the predisposing factors.
Okay.
Now, a patient who is obese will certainly at one point in time come with low back pain. Other predisposing factors include the lifestyle of the patients who are involved in lifting up of loads, or patients who indulge in smoking, because it goes a long way in affecting the collagen that, for the sake of my viewers, the smoking is also a predisposing factor. Now, coming to the etiology or the causes of low back pain, number one cause is trauma.
By trauma,
yes,
you mean?
Maybe from someone hit at the back, maybe from road traffic accident, or from fall from height, or maybe doing contact sports. So trauma is a cause. Then infection is another cause of low back pain. Infections such as infection of the bone, of the spine, such as tuberculosis of the spine. The patient can also present with back pain.
Tuberculosis, the one that we know happens,
Yes.
affects the lungs,
Yes.
can also go to the...
When it affects the lung, we call it primary tuberculosis. But when it affects other organs of the body and even the bone, it's a secondary tuberculosis, because it goes through the bloodstream and the bone gets involved, and that's what we call Pott's disease. So the patient can also come down with low back pain. Then even the posture. The posture of the patient can lead to low back pain. In fact, it has been found that wrong posture is the commonest cause of low back pain. You see a young man sitting down trying to bend his side, and maybe it's just maybe what we call our people call is just doing guy.
So all these bouncing things we
Yes,
used to do.
They now put themselves in wrong posture. And if you remember, that part of the back, that lower back, it bears a lot of weight. And that is the part of the back where you have the curvature of the spine, which we call lordosis, the spinal lordosis. So it bears a lot of weight. So if an obese patient, for example, or an obese individual is now also sitting or standing in wrong posture, it goes a long way in affecting that part of the spine which is supposed to be flexible. You know, when you bend over or you bend to the side, it's that part of the spine that actually does the bending. So the patient comes down with low back, and that's why it is very common.
About this posture, before you go on with the other causes, you know, right from, for example, when we were back then when we were in secondary school, we carry almost all our books in backpack, and then we hang it like this, and for that reason we are bent like this, and then we'll be bouncing to school. And this is going to school like 5 days in a week.
Yes.
Almost all your lifetime as a teenager, a young person. Does it have anything to do with what happens to us later? Does it predispose us to?
Everything one does on the body will cause there's a cumulative effect on the long run. Now, such a patient, it's been noticed that this low back pain happens commoner in between the ages of 35 and 55 years old. So you see that patient or that individual or that student that is carrying that heavy load and bending over to one side. By the time he's getting to that age, it's because of the cumulative effect. He now has symptoms, he now has pain at the lower back, and that comes out with what we call low back pain today. And such an individual, many have been found that when they carry that heavy load or when they are trying to lift load, they have a sudden onset back pain, which is known as prolapsed intervertebral disc, or commonly known as slip disc. This happens much more in patients who are lifting heavy load or carrying loads in an upward manner, bending to one side with the disc slipping to either side of the vertebrae.
Okay, I know there are some others you may want to talk about, but let me tell you my little story. I actually had what the doctors, the orthopedic surgeon, diagnosed for me as a prolapsed disc. A couple of years ago, I was a house officer, and a colleague of ours, finally a medical student, had died, and we went for his burial. Okay, the people in the community believed that something was wrong. Some people may be responsible for this death. They decided to bury him in his room, and those of us, his friends and colleagues, were closing the grave. So we're throwing the sand from outside through the window and door to, something I had not done in a long time, bending down with a shovel and throwing it like that. By the time we were done, we were driving back to the city where we were. We also had a little auto issue where a car hit us from behind. But I was feeling some discomfort, but then I was okay. When I got home and went to bed, I woke up the next morning and I couldn't walk. I couldn't stand. I couldn't walk. The pain was unbearable. I know I've not given birth before, and people had said labor is a very serious pain, but I felt that was more than labor. It was so serious that they had to come and carry me to the clinic, to see the orthopedic surgeon. So that prolapsed vertebral disc, can you relate it with this very activity I was involved in, and then all of that heavy lifting you talked about?
You said you were using the shovel to pack the sand.
Yes, and through.
Close the grave. Now that position, that posture in trying to lift up load, and you are bending your back only to one side, that can lead to sudden onset low back pain, which is a result of prolapsed intervertebral disc. But in this case, even though you didn't have it that time, but your body or your back was prone to having such a condition because of the posture and the activity you were involved in. Then again, you had an impact from a motor accident. Now, one could say actually that could be another cause of low back pain, maybe from spondylolisthesis, shifting of the vertebrae above the lower one. However, based on the investigation maybe you have done, and they came up with slip disc, that could have also been the case in such situation. But when this prolapsed intervertebral disc occurs or slip disc occurs, there is this sudden onset pain in your lower back. that the pain irradiates down your lower limbs, and there's associated difficulty in using your lower limb, unable to walk with your lower limb, that people will have to come and as you just described has happened to you. You could also have associated numbness or tingling sensation going down the particular aspect where the disc, the intervertebral disc between the two vertebrae at the location where the sleep is occurring, impinging on the root of the nerves
that comes from there.
Observe that part of the lower limb. So you feel that things, you feel that numbness, and you what we call radiculopathy. That's you're unable to walk.
Some people come to the clinic and they say it's when you are telling them it's coming from their back. They'll say, "No, this is where I feel it."
That is their thigh or their legs. It's actually coming from
their back.
The lower back. The nerve which is impinged upon by the prolapsed disc.
So some women come and they say, "I was washing clothes, and then I heard a sound came," and that's how they believe that somebody has sent it, because they would tell you they remember when it happened. They heard that sound came and they couldn't get up. They couldn't do anything at that moment.
Viewers out there, they need to be educated well enough on the causes of low back pain, sleep disc, and etc. And it's not demonic cause as some people have believed it in the past. The posturing, the way they bend over to lift up load, the way they bend over to do their activities, goes a long way in affecting the curvature or the anatomy of the spine. And if that persists, the tendency for the disc, intervertebral disc, to slip to either side, that to the left or to right, will now cause that sudden onset pain, impingement on the root of the nerves, subserving the lower limbs, and that would make them have this unbearable pain that will have to be relieved as soon as possible.
Well, thank you very much, Dr. Fosa. You've heard it. What may cause your low back pain? Your posture, the kind of lifestyle you are observing, bending the way you're not supposed to bend, carrying heavy load, and all that. We are going to take a quick break. When we get back, we want to look at how we can prevent this, if at all it's preventable, and then how we can manage it if we already have it. But then bear it in mind that it's a very serious thing, and it was not sent by anybody to you. You're human, and these things happen to human beings. Thank you very much. Don't go away. We'll be right back.